is dated, meaning single for one patient but multi-dose because I can use multi-doses. They should have came out of the refrigerator. They are good for 28 days if they're time dated initially. I then cleaned each of the rubber tops, regardless if there was or was not a cap on them, for 15 seconds. I know that was in 15 seconds. We're going to time lapse. You guys okay with that? I then opened up my syringe. I checked the color, the expiration date, and the integrity of the packaging. I pulled it back like a banana. I then uncapped it. I then drew up 5 units of air. I start in the clouds and I end in the clouds. I go into my MPH. Inject 5 units of air. I came back out. No medication. I'm going to draw 5 more units of air. I'm going to go into my regular. I'm going to invert my vial. I'm going to draw up 5 units of regular insulin. I'm going to go up to the 10 just to show you guys that you can do that because I've yet to mix anything. I then have a bubble. I can get the bubble by drawing up the plunger really far and all the bubbles will get stuck to the sides. Or I can flick it. And then I'm going to go back up to my 5 because that's my ordered amount. Usually I do it over top of a sink. For 5 units. I'm then going to go to the MPH. I'm going to invert my MPH. Now I have to be very precise. I need to go precisely to 10. I cannot go past 10. Now at 10. I want a one-handed recap. The needle is now inside the cap. I can touch the cap. Right? Make sense to you guys now that you've seen it? Okay. So now we need to inject it, right? Sub-Q injections. Again, in your PowerPoint slides, there are 5 sites. Do we know the 5 sites? Did we take time to review? The stomach is an organ inside the abdominal cavity. It would be really hard to inject into it.
Adipose tissue is sub-Q.
The abdomen, avoiding the umbilicus by 1 to 2 inches. Preferred site. Umbilicus, avoided by 2 inches. Abdomen is the preferred site. Okay, Jessica, I knew what you meant. Where else can I give sub-Q injections? Okay, I call those the bingo wings. Bingo! That's my grandma when we went to play bingo. And her arms would go. I'm like, Grandma, we have bingo wings. She's like, I know, I burned them. My grandma was awesome. And so it's the adipose tissue on top of the tricep. It's not the tricep, it's the adipose tissue on top of the tricep. Not everyone has adipose tissue on top of their tricep. Okay, if you can't pinch an inch, it's not adipose tissue. Right? Does that make sense? So the lateral posterior aspect of the arm is how we would say it on a test. The lateral posterior aspect of the arm, the adipose tissue. You got to pinch an inch. 2 sites, where else? Okay, well, kind of. We'll get to that one in a second. Yes, Jessica, correct. The thigh, the interior thigh. Okay? Again, you have to be able to pinch an inch. Right? Not everyone can. Professor James, thank you for the snacks. The class would like to say thank you, class.
Thank you.
Not because I have 8 hours of class, because it's with me. She told me that in the
So
hallway.
you guys only have for 8 hours. I can have them the whole semester.
You've had me for 3 years. Poor thing. You need snacks. Oh. I can tell when she's never actually mad at me, but when she's annoyed with me, she says, Dr. Myers. That's how I know, like, oh, geez, I did something wrong with Professor James. So the anterior thigh, okay? You got to be able to pinch an inch. So we got 3 sites. Abdomen, avoiding the umbilicus by 1 to 2 inches. The lateral posterior aspect of the arm, the adipose tissue on top of the triceps. The anterior thighs. Okay. Now Harrison was kind of close, or Harry was kind of close. He said the love handles. I think he was talking about these, though. We do this back here. Now, I did not come up with this name. My students did, so please, if I offend you, I'm sorry. They call it the muffin top.
Uh-oh.
For when people wear too tight of shorts and then the back roll rolls over. I don't know. That's what they call it. But it's here. It's the superior and ventral aspect of the gluteus. But again, there has to be adipose tissue. Does this make sense? Okay. 4 sites. Abdomen, avoiding the umbilicus by 1 to 2 inches. The lateral posterior aspect of the arms, the adipose tissue on top of the triceps. We have the anterior thighs. We have the superior ventral adipose tissue on top of the glutes. Okay. Muffin top. Okay. And the final one, I didn't come up with the name either, so if I offend you, I'm sorry, but it is useful. One of my cohorts called this the bra fat. So I guess, I don't know if you're born in the bra, David. Yeah. But it's the adipose tissue by the scapula. So it's right here. Okay? Does that make sense? Now, according to Ashley, I'm so tiny I probably don't have adipose tissue anywhere. Jake let me know all week that how tiny I was. So, does that make sense? So I got to find one of those sites for size abdomen. Okay? Now we don't ever have free-floating wrists. Nate, can you throw me gloves? Yes.
Do you allow them to tell you which one?
Absolutely, they can pick. And we have to rotate sites. We can't use, when I say rotate sites, you have to be 1 inch away from previous injection.
Okay.
So you can go abdomen, 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 abdomen. I can't say it anymore. I was getting tired. Make sense?
Yeah.
So that's what I mean by rotate sites. It doesn't have to be,
Different.
right, it could be, they could do the abdomen their entire lives. In 30 days before we use the exact same spot.
Okay.
Or basically if you can't tell where the last injection was, it's okay to use. Like you guys can tell I got blood work drawn there yesterday, right? Let's not go poking there again because I'll develop scar tissue. I'll develop increased adipose tissue there.
Okay.
Okay, fatty tissue because of the manipulation of the needle. So we just got 1 inch apart for 30 days.
Okay.
Okay, but yeah, they can absolutely pick their site. Right? We want to empower them in all cases. Jennifer,
Are there certain drugs that should go into?
as far as sub-Q, there are certain drugs that either have to be given IM, sub-Q, or IV, but no. There are certain drugs that you can't put. If you put, for instance, Glargine, which is our long-acting insulin, which we'll talk about, Glargine cannot be put into a site with any other insulin. So Glargine needs to have its own sub-Q site. So whether that's the left arm where the Glargine always goes, or it's always the left thigh, or whatever it might be, the Glargine or the Lantus always has to go to its own site. I'll explain why. But it crystallizes in the tissue. Okay. So now, when I pulled out this medication, what were my 3 checks and my 6 rates that Professor Barhana taught you guys last night?
Right dose.
Gotta go in order.
Right dose, right time,
Gotta
right,
go in order. There are 3 checks and 6 rates.
right patient.
Check the doctor's orders, check the allergies, check the expiration date.
Oh.
Right drug, right dose, right route, right patient, right time, right documentation. In that order and only in that order. If you don't go in the order, you don't know which one you missed. And then I'm in clinical with you and you tell me the same one 3 times. I'm like, did you get all 9? You're like, yep. I'm like, you failed med pass. Try again next week.
Both.
Because I don't know if you know which one you missed. Because you clearly think you got all 9. Because you said 9 things because you did your finger thing. You got to check the doctor's order. You have to check the allergies. You have to check the expiration date. These are all in her PowerPoint slides and in mine. Doctor's orders, allergies, expiration date. Those are the 3 checks. Then you have your 6 rights. The right drug, the right dose, the right route, the right patient, the right time, the right documentation. In that order? Yep, in that order. Could you do a different order? Sure, you could do a different order. I don't care. But you have to have a consistent order. So if you give me a different order, I'm going to ask you to repeat back that order to me. So you better know that the order. Does that make sense? Because you have to be consistent so you don't miss one of those. Okay. And then you do that 3 times, right? When you take it out of the drawer, you do it. When you have them all in a pile in the med room, you do it. And then you do it before the patient, right in front of the patient, right? You guys learned that yesterday? Okay, so we're going to use Claire as our example. I walked into the room, I've done the 5 things that I always do. Provided privacy, I've knocked, I've explained the procedure, I've introduced myself, I identified the patient, I've washed my hands, I put gloves on. Okay. Claire says she wants under her abdomen. Okay. I'm going to take my alcohol swab. Well, before they do that, make sure that we're clear. I grab my barcode scanner, I scan Claire, it opens up her MAR, I scan the medication. I validate the last time I do my checks, doctor's orders, allergies, expiration date, right drug, right dose, right route, right patient, right time, right documentation. Right? Claire, this is your a mixture of your regular and NPH insulin. The regulars that cover your blood sugar, that's a little bit high right now. It was 210. And the NPH is to make sure that you stay in that normal range throughout the day. Do you have any questions? She doesn't have any questions. He's okay with that? That's how you would explain it in clinical. Take your alcohol swab, and you clean. Problem. 15 seconds. I love nurses who do this. They'll clean. And they'll take the alcohol swab away, and then they'll turn their head, and they'll go get their needle and uncap it, and they'll come back. And they'll give the injection over here, even though they cleaned here. What do I do? Now, this is not one of the sites, but just for you guys to see the example. It's pointing right to where I cleaned. I leave the alcohol swab on the patient, pointing towards where I cleaned. There's no doubt where I cleaned. I do that for IMs, I do that for sub-Qs, I do that for all my injections. I have a free arrow. You guys okay with that? From there, I don't like free-floating wrists. This is a free-floating wrist. So if this was really Claire's abdomen, my wrist would be on her abdomen. If you can't see, you gotta stand up, guys. Are you nervous?
Yeah, never had it since.
See, so this would be the rest of her abdomen. My wrist is in contact with something. It's not a free-floating wrist, okay? It's hard for me to do because I need a pinch when I give the insulin injection. Okay, so my wrist is in contact. What degree angle for a sub-Q?
45.
45, very good. So we're gonna go to 45. The needle always goes all the way in. You selected the right needle for the job. It's a sub-Q injection. You know that it is a 3/8 to 5/8 inch needle. The needle goes all the way in. You don't guess how long the needle goes in. You selected the right needle for the job. If they're a very skinny person, get the 3/8. If they're a little bit bigger person, get the 5/8. Select the right needle for the job. Okay, once I let go of the pinch of the inch, I then inject my medication. Some people will tell you to leave the needle in for 5 or 10 seconds. It's in the literature, there's no rationale to it. So I don't, so I take it right back out. And then once it comes out, I want you guys to hear this for the rest of your life. Safety, 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 safety. You hit the radial nerve, the patient's arm is paralyzed, they can't move it. Safety, 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 safety. You hit an artery, it's pulsating blood at you. Safety, 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 safety. The patient says, you mother, that hurts so bad. Safety, 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 safety. The patient quit breathing, you have to code them. Safety, 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 safety. What's the first thing you do when you take the needle out of a patient?
Count.
You safety, 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 safety the needle. One time we were doing CPR on a patient. Another nurse was putting an IV in. We were compressing the patient. The patient got jabbed 28 times before my colleague got jabbed by the same needle. Because someone did not safety, 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 safety the needle because it was an emergent situation. Emergency doesn't mean you get to act a fool. It means you get to act calm and collected like a professional. You take a needle on a patient, what do you do?
Recap it. What?
You put it in the sharps container.
Safety it. What do you do when you take the needle out of the patient?
Safety.
Safety it. I thought you were being sarcastic at first. I just said safety 1,000 times. You safety this one by sliding this up and then twisting it.
Whoa.
Now it won't go back down, you can't twist it. Now it gets put into the sharps. We never recapped a used needle. Okay, practice giving a sub-Q injection.